It's very important before we start the consultation is to understand the patient classification. And now what I have tried doing here is I have divided the patients into 4 different categories, and we will be mixing and matching them together to find out what are the sort of patients that come through the door in a dental practice. So looking at the first column, first quadrant here, where we are talking about easy patients, and we mix that with wanting patients, meaning which the patients are quite comfortable coming to the practice. The patients sort of know what they are coming into the practice for. They are quite comfortable with the dental environment, and they want the dental treatment. Now, a patient who is easy, who is wanting the treatment, a big tick to that. You definitely are, it's all good to perform treatment on that patient. But then there is another category where it is a difficult patient. And when I say a difficult patient, I don't mean to say the patient who's nervous is a difficult patient. It is difficult for the patient to be in the dental environment, to be in the dental chair. They are nervous, they are anxious about something, they are unsure about what they want to achieve. They are going through, something in their life which is making them really upset. So that is the classification of a difficult patient. But if there is a difficult patient and a wanting patient, as in they want the treatment still, I think that is the category where your consultation comes in really handy. Because if you can do your consultations well, and if you can build up the rapport with the patient, then it's an absolutely magical pill. Because then what happens is whatever you are doing in the journey of the treatment for the patient will be very well accepted, compared to if you just started a procedure without building the rapport and then end up with anything. Because dental procedures are very subjective. It's a very subjective treatment as much as it is a clinical treatment, because what you might think is absolutely fantastic might not be the same for the patient. So it's very important to make sure that you are on the same page before you commence the treatment. Obviously, there is a classification which says a difficult patient and a not wanting patient. Now, a difficult and a not wanting patient is probably someone who you don't want in your practice, because as I always say, for anything, the 80-20 rule applies. You don't want to be treating all the patients in the world. Not everyone has to go through your clinic. And at the end of the day, someone might be difficult and not wanting the treatment with you, and that's absolutely fine. They can probably see another dentist. And last but not the least, obviously, the easy patients who are quite comfortable with everything, but they don't want the treatment. And once again, they fall in that 20% category where you are happy to provide them the preventative care, where you are happy to provide them the general care of their oral hygiene and general oral health, but you don't have to look for anything major, or you don't have to push for anything major, because they are not wanting to get the treatment done. And that's, once again, it's all right. Because like my rule, as I always say, my main thing that I go by always is 100% acceptance rate. And that always comes from where there is an option where you are telling the patient, my main mantra is 100% case acceptance. And that only comes from when you have actually explained to the patient that not doing a treatment is also an option. So if that has been there, then that's absolutely fine.